blood, right, or the amount of plasma, or like keep the water in the blood so that it doesn't excrete it, so that it can have a normal blood pressure. Because if there's low blood volume, then the kidneys will be like, yo, you got to get on this, and then it won't excrete water to keep the blood volume the same. Makes sense, I guess. I mean, we don't really need, I'm not going to focus that much on that. This is crazy. Okay. All right. So does everyone have a basic understanding of what this means? A little bit, maybe.
Yeah.
Maybe? All right. I can confuse you more. I don't think it's that important. I don't think this is going to be like 100. Like, I don't think there's going to be like, there might be one question on a concept that we learned in here. I don't think, because we're going to mainly be going over, like, we have to go over the respiratory system, the kidneys, and all that stuff. So I doubt there might be one question. She's got a lot to go over. Anyways, basically, these are the things that go into the blood pressure. And this is what I was, wow, guys, I didn't even know that this was on here. Wow. And it says it. Anyways, okay. So the kidneys do control the blood volume. And, that's kind of how to keep the cardiac output similar, right? If you have low blood volume, then this is bad. You don't want low blood volume. So the kidneys will basically be like, you need to keep that water, and they won't excrete it, and it will cause reabsorption so that you can keep high blood volume, and it can like enhance thirst so that you want to drink more. Yeah. Okay. To increase blood pressure, because cardiac output is the main factor in your arterial blood pressure. Okay, so this is something she did talk about. So baroreceptors, what are they? What do they do?
They maintain constant pressure on a minute by minute basis.
Yes, yes. And what do they mainly deal with? Do they mainly deal with the sympathetic system or the parasympathetic system? What does it affect most?
The sympathetic.
Well, they deal with, yeah. So basically, yes. So baroreceptors help the parasympathetic system be in check, right? That's what they do. So they basically work with them. And so when the baroreceptors are turned off, right? When they, let's just say you constrict it, or blood pressure, I think it's when baroreceptor, it keeps the blood pressure constant. And if the sympathetic, okay, so like she gave an example to your limbs, right? And when it does that, then your blood is like, oh, you have really low blood pressure. Oh, great, my internet connection sucks now. Why is that? Why does it do that? I should probably plug my phone in, but so if the parasympathetic, if you're sitting in bed, you're fine, your parasympathetic is up, right? Your reflexes are fine, right? If you get up suddenly, right, your blood will pull into your limbs, and your baroreceptors be like, oh, this is not good. So it will basically inhibit the parasympathetic response, and therefore the sympathetic will take over, and it will cause your heart to race and you to get dizzy. Do you remember her talking about that? So yeah, so that's what it deals with, and it basically just keeps the blood pressure the same. And a lot of people, they have problems where they have, I'm guessing, high blood pressure constantly, and baroreceptors, they basically can't control the fluctuations in blood pressure anymore, so they go up and down and up and down. And certain drugs work to try to stabilize the blood pressure at a consistency. So the baroreceptors, if you're just normal, they will come up, and if they go down, then the sympathetic response will take over and cause your heart to beat faster and kind of normalize the blood pressure again and create high blood pressure because it constricts. That's why it doesn't make any, anyways, whatever. Me and the constriction, the pressure, and it's like, anyways, but she'll probably explain it tomorrow, so it won't be a problem. She said that she doesn't really want to talk about this that much, but just to that it's stretch receptors on the aortic and the kind of they're right here, right? Firing rate increases when pressure rises. BP, blood pressure increases. Increase firing rate, decrease firing rate. Okay, so the firing rate. So if blood pressure increases, it will increase the firing rate of the baroreceptors to allow for the parasympathetic division to take a hold and decrease the blood pressure to maintain it. If the blood pressure rapidly decreases, like if you're jumping out of bed, then it will decrease the firing rate of the baroreceptors and allow for the sympathetic division to be like, hey, we're up here, we got to increase that blood pressure real quick. So effects of receptor firing, it decreases the vessel tone, which equals vasodilation. And you can think about that. So that does kind of make sense. So if blood pressure is high, it dilates. This is why that picture doesn't make any sense. The vessels dilate and allow for more blood flow, less resistance, right? So flow and that's something. Flow and resistance are they're inverse. So flow goes up when resistance goes down, and resistance goes up when flow goes down, or flow goes down and resistance. When resistance goes up, flow goes down, because if it's tighter, then there's less flow. If it's more, then there's more flow. And it also decreases heart rate because it enables the parasympathetic division or the vagus nerve to decrease the heart rate. So this is what it says right here. Oh, when you can't breathe, you're dying. Okay. Thank you, Brittany. Okay, so this is what I was talking about before. Maintain a constant pressure on a beat-to-beat basis. If you jump out of bed, your heart races, and that's due to less baroreceptor firing, because when the baroreceptor fires, it allows your blood pressure to come down because it increases the dilation of your vessels, and it allows for your heart rate to come down. That's why when you jump out of bed, you have less baroreceptors firing, and this enables your sympathetic system to turn on and increase blood pressure, and your heart beats faster. Okay. She just said carotid massage, you can actually like pass out. And if you massage both carotids, you can stop the heart. And this maneuver, I guess, is when you're like weightlifting and such, where it can basically, it's interesting. She said when decreases. Okay, so it can basically help in cases of supraventricular tachycardia, where your heart is beating too fast. It decreases your pressure in your blood vessels initially, but later increases the vagal tone, which just means the sympathetic response on the heart. So it just slows down your heart rate and makes your blood vessels dilate so that it allows more blood flow and not so much, not your heart beating as fast. Does anybody have any questions?
I don't think so.
Okay, lovely word. Medulla oblongata. Love that word. It's great. All right. This chart she didn't really talk about, so not going to talk about it. Okay, so what's pulse pressure?
The top one minus the bottom one. Systolic minus diastolic.
Yes, perfect. Jack Saint, it's perfect. Lovely. Yes. All right, so exactly. So it has to do with atrial compliance, so the elasticity of your atria to basically recoil during a diastole. So if basically do you want your pulse pressure to be high or low?
Low.
Low, exactly. You want it to be small or low, right? And because you want your arteries to be compliant, you want them to be able to stretch and recoil and force more blood through your system so that you basically your blood is still moving even during rest, right, of your ventricles. Yes. Okay. So if I'm 73 and I go to the doctor and they tell me that my pulse pressure is 70, right? Why is that? Is that bad or good?
Bad.
Bad. Okay. And what has it mainly to do with? I mean, it could deal with a couple.
Your systolic pressure is increased and then your diastolic decreased.
Yes, and this is because it's when you get older, basically the compliance of your arteries are less than because they are older and they've suffered a lot, probably high blood pressure and all this different stuff, and the resistance is greater, but basically your arteries are not as compliant, which means that they don't stretch as much, and mostly that they don't recoil as big, right? As much because you're older, basically. They've done it a while. Anyways, does that make sense? Did I confuse anyone? Hopefully not.
It makes sense.
Okay, good. I love hearing that. It's my favorite thing on the planet. Okay. All right. So this is basically showing you that atrial compliance in large vessels, they stretch during systole to allow for the blood to come into the arteries, and then they recoil, which means like if they stretch and then they push it along so that even during stretch that they're just they still allow blood flow even when the ventricles are resting. And this, like I said before, it decreases with age because of the loss of elasticity of the vessels, and it can effect on pulse pressure. It exerts stress on downstream vessels, probably because they don't have as much blood. I don't know that part. She didn't really talk about it, so I'm not going to talk about it. Okay, so basically it's just the ugliest photo in the world telling you what happens during recoil. And the blood's going in it, so it expands to allow more blood flow. And then after it's done, it basically comes back, hits this closed AV valve, semilunar valve, and recoils and pushes the rest of the blood along to allow so that the flow during ventricular relaxation. Everyone understand that?
Yes.
Got it? Cool. That was the saddest yes on the planet. I've never heard. Yes.
Yeah,
Sadly.
I understand.
All right. So mean arterial pressure. So she explained it. So mean median, mode. I know it's a horrible part it's actually probably a good part in your statistics class, if any, but I think everyone took statistics, but yeah, mean, median, mode. That was the only thing I liked in the entire statistics. Just kidding. It was fine. But yeah, so mean would be the average arterial pressure. And how you get that is you take diastolic pressure plus 2/3 of pulse pressure, and you would get the mean diastolic pressure. And what that normally is 100 grams of mercury, or whatever the hell, how do you ever say it? But that's basically what it is that it's usually 100, around 100. So we can all do a math problem together because I know you all want to. I know you've been dying ever since last time. Okay. So, hi, my name's Olivia. My diastolic pressure is 70. And that sounds wrong. Is that right? It's around it, right? Because diastolic spot. Okay. So my diastolic pressure is 70 and my pulse pressure is 40. So what is my mean arterial pressure? Just take a minute and do it together. And you have to grab a calculator.
So basically the mean pressure is the diastolic plus 1/3.
Yes. So how you get it is you take my diastolic pressure, which is 70, then my pulse pressure was 40. So how you do it is you 40 times 0.33 and you would get 13.2. And you add those together and you'll get 40. You'll get 83.2.
So that's your mean. 80.
Yeah. That's my mean arterial pressure, which is lower than the average. So I don't know what that means, but it's lower. So that's not good for blood flow, I guess, because you want high to low, right? So that's not that good. We got to get that up there, I think, right? I don't know. Makes sense, I guess. I just have a low diastolic pressure, I guess, because this guy, he is 90. That's 80 is normal, right? 120 over 80. I have a lower than normal diastolic pressure. Okay, so like I might be older, I guess. Who knows? What age am I? Age me. I wonder if we can do it later on. All right. Okay, I'm gonna plug my phone in real quick. My phone charger's like right there. But take me like a second. But if it dies, then we lose me, and then I go into the Netherlands. I was on 1% too. I would have been. I was right there. Okay, so everybody got this. Does anyone have any questions about how to calculate or anything? No? Okay. Everyone was probably sitting there like, dude, I did this like 5 minutes ago. I tried. Okay. So it's just a summary about everything that we talked about. Does anybody have any questions about it or like confusion about anything? I mean, other than stuff I can't explain because I don't know. No. Okay. All right. So the regulation of flow, so the sympathetic division increases the cardiac output in the total peripheral resistance and constricts the vessels at first. Okay, so at first she explained this to me because I had this question during the last, I was like, why does it constrict everything at first? And she said that because before it really kicks in, it constricts everything and then it opens up to like the muscles and all that stuff. But before that, it like will constrict everything. So that's what she said to me.
What do you mean by everything?
Like it will constrict like all the arteries everywhere, like to all the places. Of course, not to your brain and stuff, but like to your muscles.
Okay, that's the sympathetic.
Yeah. So like at first, but then after that, then it will like dilate your muscle, like to your muscles and stuff. Like, but at first it like completely everywhere it constricts and then it opens up to your muscles. And then she also said that that's why, well, it's a part of the reason why it's painful at first, but the majority of the part is because of the like buildup of, that's on the next slide. I'm not going to go ahead because I need to look at it, but there's different types of buildup of certain, like, I don't know how to call them, but like wastes in your muscles and stuff. And when you open it up, it goes like, it gets out of there, and that can also, yeah, I'm not gonna explain it until I get there. But all right, so increased tone during fight or flight. So then after, so it constricts the digestive tract, the kidneys, and the skin vessels, and dilation of the muscle vasculature. So it means it goes to the muscles as well. And it diverts most of the blood to the skeletal muscle. We saw that chart where it was like that big pie thing, and like a large chunk of it was going to the muscles, and that's very true. And over time, other intrinsic mechanisms produce large increases into, well, more so, because she also explained to me that once after the part works, it constricts everything, then it opens up to the muscles, and then there's other different types of things like glucose that will also open the vessels even more so and make them even bigger. She said that in the sympathetic control of blood, in a large amount of it, it does produce vasodilation, but the vessels aren't well innervated. So that just means that there's not a lot of, I guess, receptors for acetylcholine on there to decrease the blood flow. But I'm guessing that in regards to the baroreceptors, because that does play a large role, that it decreases. And plus, like, I'm guessing on the digestive tract and the smooth muscle, there is a lot of receptors because you want to increase blood flow. I think that there's like different things that help it, but it doesn't have, it's not well innervated. At least that's what she said. Does anybody have questions? Did I confuse anyone a lot? Hopefully not. Okay. All right, so paracrine, it's like look effects, and they can do things as well. And she talked about this a little bit. I didn't really understand. I mean, she talked about how in like cardiac, like if somebody has a heart attack, basically, that there's things that go to the source and dilate those blood vessels really big. And I didn't really understand, so I can't really speak on that. But she said that she doesn't learn it. She's not going to be tested. We're not going to be tested on it, so that's okay. Somebody will explain it much later in different times. So yeah, so this right here dilates coronary vessels to reduce pressure and makes sure that all the blood's getting moved and pushed along and all that stuff. So, hey, okay. She really didn't. She said we didn't need to know any of this, so I'm not going to talk about it. She said that the only thing for endothelin 1 is that it basically stimulates vasoconstriction. That's it. She said that's all that you need to know, really. Because later on when she asked for in like pharm, that if you gave someone this drug or something to block this, then what would it do? It would dilate. Things like that. So, but she said she's not going to ask that, so it doesn't really matter. I mean, it does matter later on, but okay, regardless. All right, so intrinsic regulation of flow. So this is one place where you think it'd be extremely important to have myogenic control.
Brain.
The brain, right? Yeah, exactly. So the brain will be one of the most important things because you don't want to pass out if a bear's chasing after you or you're dead, okay? And you don't want to like pass out if you're eating a great sandwich, you know, like you don't want to, you know, you want it to be regular so that, I mean, you're not going to pass out if you're eating a sandwich. You don't want, I mean, like, I guess you could, I mean, if it didn't have this and all the blood was going to your stomach to eat the sandwich, then I guess it could, whatever. I'm sorry. Anyways, okay, so decreased pressure, right? If there's a cerebral artery dilation, you know, it tries to decrease the pressure to not allow like too much blood to the brain, right? And if there's increased pressure, it will constrict the cerebral arteries. Okay, I'm sorry. If there's decreased pressure, then it will allow for cerebral artery dilation to allow more blood. That makes sense. If there's increased pressure, it will constrict the cerebral arteries to allow less pressure in the brain. Okay, now I get what you were saying. I do now. Okay, so it will constrict the cerebral arteries to not allow as much blood into the brain. You know, too much blood or too little blood in result of decreased pressure. So no matter what's happening in the body, it tries to keep the blood flow into the brain the same. Does that make sense? Hopefully I made sense. So if the afterload or the blood pressure, if the blood pressure increases, what would the vessels do in the brain?
They'll constrict.
Yes, and if the blood pressure decreases in the body, what would it do in the brain? What would the vessels do?
Dilate.
It would dilate. Perfect. That's exactly what I wanted to know. All right. So this is also what I was talking about. So when flow increases, there's metabolites that sit in there and basically wait to, for the bait did not wait in there, but they build up. And you'll know, she gave an example. When you first start working out, your blood to those parts of your body doesn't go very often, I guess, like not to an extent which you need it to. And so the metabolites that sit in there, they basically, when they go back, they go really to your kidneys, right? To be flushed and either to be excreted for the most part. So a lot of people, when they start working out, at least my trainer said, and what she said, your kidneys will start burning, or your back will start burning a lot because of all those metabolites are being pushed into the kidney tubules and basically being reabsorbed or basically being filtrated for the most part. And so as flow increases to the skeletal muscle, the metabolites will be washed out, and this can also cause burning. And of course, as flow decreases shortly after exercise ends, then it will build up again. But you know, if you like don't work out after a while, of course there's going to be more metabolites in there. Whereas if you work out every day, it's not going to burn as bad, I'm guessing. Okay, so cardiac muscle receives blood during diastole, which makes sense because basically when the heart's not contracting, it allows blood to flow out of the right atrium, out of the somewhere left atrium. And they go around the blood and oxygenate. Well, I can't talk anymore. And she just said that cardiac muscle does well under aerobic, not trying to say it correctly. Sorry. Not anaerobic, aerobic respiration, which means with oxygen, and it works well with when you're like, if you're running, you're breathing and you're allowing oxygen in. A anaerobic exercise isn't swimming anaerobic, right? Am I right or am I wrong? Swimming, is that anaerobic? Like the one that doesn't need oxygen?
I really don't know.
No one knows. Okay. Well, I thought I read somewhere that it's anaerobic. It's increasing the load on the muscles, but it's not increasing your respiration. Right? Or like oxygen, so it uses glucose and turns into lactic acid, and it causes burn in your muscles and stuff. I don't know. Anyways, she talked about it a little bit, not that much though. But anaerobic exercise doesn't require, or like anaerobic means lack of oxygen. So that causes angina because of the lack of oxygen and like heart, chest pain and stuff like that. And yeah, lactic acid. And I pointed to my lactic acid because that somehow, she talked about it a little bit, but basically you don't like anaerobic for people because it causes angina because of the lack of oxygen, and aerobic increases oxygen, so it allows for perfusion of oxygen in the heart, and that's good. We like perfusion of oxygen. We like that. Did that make any sense? Did I confuse anyone? I probably did. I'm sorry. I apologize. No? Okay. All right. So this is just going over everything that we went over. That the flow and factors that control, if resistance goes up, well, that's not really, okay, I'm not going to do pressure. I'm going to do resistance and flow. If flow goes up, resistance is down. And if flow goes, or resistance goes up, flow goes down. I'm not using pressure because I don't understand it quite. No one understands. Like,
and then if viscosity goes up, then the flow goes down.
Yes. Yeah, and this has to deal with resistance, a total peripheral resistance, and if the radial, if the radius of the if the aorta, not aorta, if the radius of the artery is big, would that allow for more blood flow or less blood flow?
More blood flow.
Yes. And if the viscosity of that blood is thick, would it allow for more blood flow or less blood flow?
Less.
And she said that we don't really talk about vessel length at all. So I'm not even going to talk about that. Flow regulation. So in the fact of like the parasympathetic division, it's not really so well innervated, right? So it doesn't have a lot of receptors that take the acetylcholine and allow for vasodilation. But the parasympathetic will dilate vessels to the kidneys and the kidneys probably have to stay a little constant, but the stomach and the mesenteric and that sort of stuff. And when you're dealing with the sympathetic division, most of your blood flow will go to the muscles, right? To the skeletal muscle. Okay. And just think about like what does the parasympathetic do? What does the sympathetic do? And I don't think she's going to ask more than like 2 questions on this. So it shouldn't be a problem. And myogenic control, like what does that mean? What does that do?
That's the one that has to do with the brain.
Yes. And what does it allow? What does it do to the blood flow?
It dilates.
Yeah. So I said that wrong or like weirdly, but it keeps the blood pressure constant so that depending on what's happening in the body, that the blood to the blood to the brain is like constant and not varying. Like If the blood pressure is really high in this body, it doesn't allow a lot of blood because it constricts the vessels so that it stops the blood flow. And if the blood flow is really low in the body, it will dilate the vessels in the brain to allow more blood flow. You got that?
Yes.
All right. So active hyperkalemia, basically during exercise, the flow increases to the skeletal and cardiac muscle to allow for, you to use them, and the metabolites will be washed out.
What exactly are metabolites again?
Like, they're basically like built up of stuff that your muscles, I'm pretty sure it's probably like lactic. I don't really know. I don't know. I don't know, Morgan. I
Okay.
can't tell.
I'll just look it up.
I'm sorry. I don't know. But it's just like buildup of stuff that's like sitting there, like waste, not stuff that you need or that you want. Just like waste that sits there. It's like trash. You got to get it out or something. I don't know. We tried. Okay. So now for the fun part, guys. I know you're so excited for this whole thing. Does anyone have any questions and go over before we go on? It's the fun part.
What was on the first anatomy exam? The integumentary system and what else?
And the autonomic nervous system.
Oh, right. Okay.
Is the exam going to be cumulative?
For
The anatomy part.
yeah.
Only
Anatomy.
anatomy.
I know you guys remember this one. I know you do. I know. I got so nice. All right, guys, you ready?
We're doing a Kahoot?
We're doing it. Yes.
Oh, I'm ready to lose.
And we're all gonna lose because we all have to remember.
You're not the only one.
What is this going to be about?
To me, the nervous system.
Wait, we need to like sign in, right?
Yeah. So you just go to you can either go on your phone or you can go on I wouldn't go on your computer depending on what you're using right now. Just go to www.kahoot.it and it will just like immediately take you and it will say type in your game pin and then it'll have you type in your name and then that's pretty much it. And it might try to kick you out once or twice. But like I'll wait until everyone's in there. I know how many people are in, so. This week,
Your emoji is so cute.
I'm sorry.
Oh no, I was just saying that I like Morgan's emoji, like the heart.
It's black like mine. It's heartwarming. Oh, should I probably stop the recording?
Yeah, because then you could always send this in the Kahoot in the group chat, right? Again, so people could do it. It's up to you.
I'll
Whatever you want to do.